Cancer is emerging as a major public health problem in Africa because of the population aging and growth, as well as the increased prevalence of the key risk factors, including those associated with the social and economic transition. The Merck Foundation conducted its third Unesco Merck African Research Summit, March 2017, aimed at promoting women and youth in scientific research through providing them with the training opportunities to advance their capacity, with a special focus on cancer care.
Empowering women and youth in STEM with a specific focus on scientific research, and also focusing on very important emergent challenges for Africa is cancer research and vaccine development.
For the third time, the Merck Foundation is partnering with Unesco, the African Union and Cambridge University to empower young researchers and to build research capacity across Africa.
In females, the number of the cases and rates of the breast and cervical cancer are almost equal and comprises of the 50% of the overall cancer burden in Africa.
Over the past year, while serving as chairperson of the Stop Cervical, Breast and Prostate Cancer in Africa, I have been made more aware how breast cancer is more clinically aggressive in young African women. Over 50% of women with breast cancer are under 50 years.
Women across the country suffering from this menace have experienced a lot of the challenges, more so those coming from the poor families. These women from Madari, Nairobi County have formed a business society which aims at boosting their income, but this is not enough.
I am a 3.5-year breast cancer survivor. The type of cancer I have is triple negative. That means it is not receptive to estrogen or progesterone.
The women encourages themselves to perform monthly breast self-examination in order to catch any changes in the breast early and thus initiate timely treatment.
So I have to use organo supplements, and they are made from a mushroom called Ganoderma. They are quite expensive, 3,000, but up to maybe 5,000 per packet, but you use them in a month. Though they are expensive, they are helpful because they help me to control my pH levels. So in short, I can say that the cancer journey has not been very easy. It's quite traumatizing when you are told you have to cut.
In males, cancer of the prostate dominates in terms of the number of the cases of the total estimated cases in the region, followed by the liver cancer and the Kaposi sarcoma.
And we focus mainly also on empowering and providing this fellowship for women, if they are available. We focus on women and on youth, so you can be the future of healthcare and the future of cancer care improvement in Africa.
Around 1 in 26 women will develop cervical cancer in their lifetime, and 1 in 40 will die from the same disease.
Mine was stage 3B. Actually, it was about to go to stage 4, so it was very scary. I had just lost my father the previous year, and I thought now that would be the end. Luckily, my mother was still there. She journeyed with me for 2 years. She accompanied me to Aga Khan for treatment, which is very expensive, but Aga Khan was also able to support me. I managed to finish all the chemos. I did some breast conservation and radiation. Unfortunately, when I went to India, I was found to have a tumor had persisted.
In Kenya, cancer is ranked the 3rd cause of death after the infectious and the cardiovascular diseases. A cancer diagnosis comes with feelings of shock and denial.
And all in Gambia and Kenya, and either are enrolled already or will be enrolled in this fellowship programs, which is being held as 1 year or 2 years or 3 years oncology fellowship programs in Tata Memorial Hospital, which I take the opportunity to thank them because they are taking the biggest role to develop and build capacity of cancer care in Africa. Because you know the lack of oncologists is very, very crucial to improve the access to cancer care.
A cancer medic cites the need for a strong supportive network to enable the patients face the treatment and management phase of the disease.
The testimonies we have heard today are true evidence of how breast cancer has become a rapid and ruthless killer, not just of Kenyans, but of Africans across the continent.
And of course, also we have another program we're doing it with in partnership with the University of Nairobi, and this is also the first fellowship for medical oncology held in sub-Saharan Africa.
As part of the Merck STEM program for women and youth, Merck Foundation, a non-profit organization and a subsidiary of the Merck KGaA Germany under the patronage of the President of the Republic of Mauritius, Amina Gorib Faki, agreed to put up proper measures in curbing the serial killer disease.
So this is the way how we put the empowering women and youth in the center of every and single program and objective of Merck Foundation and our programs, and selecting our partners as well.
Whenever I'm seated, or even whatever I'm doing. And so I've been using this, and I'm grateful to Paula's group for making it. And then there's also this breast, which we use, because once you remove your breast, as a woman, you know your dignity is quite low, and your confidence. But when you're able to put this under your, and move around, you're just okay, and you have no worries.
Therefore, one central objective of this conference is to further empower women in research.
Ekelej, on her part, says she will continue with her efforts in supporting the African research community with a special focus on women and youth.
Empowering women and youth in STEM with a specific focus on scientific research, and also focusing on very important emergent challenges for Africa is cancer research and vaccine development.
Conducting the third edition of UNESCO Mars in Mauritius is valuable for us as it complements our national strategy to promote scientific research, empowering women and youth in STEM, and our Ministry of Health focused strategy on improving cancer research and access to cancer care.
The medics narrate that whereas breast cancer awareness is a national and globally observed, it is imperative that patients who receive a cancer diagnosis at any time of the year are offered the necessary psychosocial support.
Indeed, I am confident that with sustained investment from numerous stakeholders, including our Ministry of Health, Kenyatta National Hospital can one day become a regional leader in cancer treatment and management.
Radiotherapy alone, for instance, would probably cost 10,000 in Kenyatta Hospital, would cost about 500,000 in a private hospital.
During the summit award ceremony of the Merck Foundation, 5 winners from Cameroon, Nigeria, Rwanda, and Mauritius were recognized and awarded respectively for their excellence in research under the category of the best winner of the Best African Women Researchers Award. A Merck Foundation, established in 2017, is a subsidiary of the Merck, the world's oldest pharmaceutical and chemical, Vimosny, established in 1968. The founding family remains the majority owner of the publicly listed corporate group. Reporting for Ebru TV, I'm Jeff Haemba.